Hey guys, it's me, Tim.
And me, Camille.
So first, some news. This is our last episode of Season 2.
Aw. Yeah, we're going to be taking a break for a while to produce some new shows for Season 3, which is going to be awesome, we can assure you.
What we haven't exactly worked out yet is when we're going to come back for sure. Our best guess is late spring to early summer at this point.
But we'll keep you posted and maybe even drop some goodies between now and then.
But enough about us. Let's get back to today's show.
Indeed, because we've got a lot to get through. As you know, We Live Here is all about systems, auditing systems and bringing you stories about people running systems, those affected by systems.
System-y
and
stuff.
Often systems. And often people trying to change systems.
So we thought it fitting to end our season by examining like the ultimate system, one that literally can make the difference between life and death. Everybody in this country seems to be talking about it these days, the healthcare system.
We know it's a doozy and daunting. And most importantly, it's likely to undergo a huge change now that we have a new president and Congress intent on repealing the 2010 Affordable Care Act and re-engineering the way healthcare is delivered in the country. The debate about this has been years in the making and kind of inescapable.
Today, after all the votes have been tallied, health insurance reform becomes law in the United States of America.
There's at least one instance in which many members of Congress are feeling the very same pain that the rest of America is feeling. And that's with this new health care law.
And how many people in South Florida were able to successfully sign up today online using the website? The Secretary says the number is 2.
The U.S. House of Representatives has again voted to repeal Obamacare, despite President Obama...
After multiple challenges to this law before the Supreme Court, the Affordable Care Act is here to stay.
Supreme Court ruling that it's constitutional doesn't mean that it's good policy for the country. This law is...
We are repealing and replacing Obamacare.
If he does repeal Obamacare, as he's promised to do, what is that going to mean for you?
No insurance.
So listening to all of that, obviously it's a lot to get your head around. And frankly, right now, I mean, they could change it any second.
Yeah, when we last checked, which was like yesterday, the latest was this. Almost immediately after being sworn in, new President Donald Trump signed an executive order that gave federal agencies permission to scale back regulations and penalties associated with the law.
But we should note that that executive order gave no real specifics about what that actually means in practice.
Right. And Republicans also passed a legislative tool called budget reconciliation to signal their readiness to unwind parts of the law that directly impact the federal budget.
Meanwhile, Democrats are vowing to resist. That was totally expected. And no one is yet sure what a replacement law would even look like.
Because, again, remember, this could all change, like tomorrow. But the context probably won't.
So on today's show, we ask two big questions. Question number one, how is all this uncertainty about the future of the Affordable Care Act rippling out from patients to doctors to insurance companies?
And question number two, how would a group of people exempt from the ACA who don't even believe in health insurance go about trying to set up their own system?
We live here.
We live here.
We live here.
We live here.
A project exploring
race,
class,
power,
poverty,
systems, and the people they touch.
I'm Camille Stanley.
And I'm Tim Lloyd. And from St. Louis Public Radio, this is We Live Here.
A lot of what's about to happen will depend on how Republicans strip the law down and whether or not they replace the Affordable Care Act. After all, it's worth noting that the 2,700-page law substantially changed an industry that makes up about 18% of our GDP.
And the headlines can be downright scary. An estimated 22 million people could lose their health insurance without a replacement. Aline Singer is with the Heritage Foundation, a conservative think tank. She hopes that whatever happens, it will be less expensive than the Affordable Care Act.
We believe that we need to help people and that we need to make sure that healthcare costs go down to make insurance more accessible to people, but not that we're just overly subsidizing the purchase of insurance and the cost can rise no matter what because the government's paying for it.
So what exactly would this new plan look like? Well, over the past 6 years, Republicans have released many policy outlines to replace the ACA, but have yet to agree on the details.
At the same time, there are some common themes. Let's take protections for people with pre-existing conditions, for example. That's part of the ACA. And almost all Republicans say that's a good thing and they plan to keep it. But they want this stipulation.
And that is that individuals have to remain continuously enrolled in a health plan.
DePaul University health law professor Wendy Epstein says requiring people to always have health insurance might not be realistic.
Cash flow issues to changing jobs, and healthy folks, frankly, might not be concerned about what will happen if they later become unhealthy.
House Speaker Paul Ryan has proposed using high-risk pools to cover people with pre-existing conditions. But even then, Wendy says, that might be too expensive.
All right, let's look at another big part of the law, Medicaid expansion. Republicans, for the most part, don't like that. So many are proposing changes to funding by giving states big chunks of money and letting them spend it as they see fit.
And that's kind of a big deal.
Kim Menard researches healthcare management at St. Louis University.
So I think that some of the people who are covered even under the Medicaid expansion may lose their coverage depending on how much of the cost gets shifted to states and what the priorities are for that state. And that's kind of a big deal.
We could keep going through the list of potential changes, but I think you get the point.
Whether or not you like or don't like the Affordable Care Act, whatever lawmakers decide in the coming weeks and months is going to affect an awful lot of people.
And as St. Louis Public Radio's health reporter Dury Buscarin is about to tell you, not knowing what the future holds is sending out ripples of anxiety.
A major part of the ACA is the individual mandate, which requires all Americans to have health insurance or face a penalty on their taxes. So a good place to start mapping out all this anxiety is with someone who's trying to stay healthy and follow the rules. Which takes us to this auto shop in North St. Louis. That's where mechanic Tony Twitty is finishing up a vehicle inspection on a 2006 Mitsubishi Eclipse. As he works, one of Earth, Wind & Fire's greatest hits plays in the background. Tony opened Tech One Complete Auto Services back in 1999, and business is good. But like a lot of small business owners, health insurance was out of reach for him before the Affordable Care Act. In 2015, he found a plan on healthcare.gov.
But, like I say, in this business, you can no telling when you might get hurt. So you need something at all times.
Tony, who's 55, was able to cover himself and his 9-year-old son for $79 a month, thanks to income-based subsidies. Later, when he hurt his knee while carrying luggage through the airport, he was glad he had it.
They x-rayed it and everything and gave me my advice and, there was a little arthritis and I was off and running.
Next year, though, is a big unknown for people who buy health insurance on their own. Those income-based subsidies Tony uses to help him afford coverage could be repealed by Republicans in Congress, alongside federal funds that pay for expanded Medicaid programs. Tony says he just hopes he can still afford whatever coverage is available next year. He has to be healthy to keep working, and if he can't work, it's not just a problem for him.
The poor keep the wealthy going, and the wealthy keep the poor going. It's kind of like we all got to scratch each other's backs, to keep this thing going.
Between plans bought on the exchange, Medicaid expansion, and other tenets of the Affordable Care Act, the U.S. uninsured rate has gone from 16% to about 9% in 6 years, according to the National Health Interview Survey. And keeping people like Tony insured is important for more than health reasons. When more people have coverage, it means fewer people may go into debt after a bad accident or a cancer diagnosis. And the potential for the uninsured rate to go back up makes at least one gigantic industry, health insurers, really nervous. About 100 brokers, agents, and HR people got together one snowy morning at a meeting of the St. Louis chapter of the National Association of Health Underwriters. One of the group's national lobbyists, John Green, is in town to explain what they can expect over the next few months and how that'll affect health insurance plans in 2018.
There'll be a long transition period of at least 2 years, probably 3. So I don't think that people need to worry about losing their coverage who already have coverage. There's a recognition that there are 20 or so million people with coverage today. And I don't think they have to worry that they're going to lose it tomorrow.
To John, the market for individual insurance plans, like the ones on healthcare.gov, is broken. He says not enough people signed up for coverage, and it was too easy to sign up for a plan and cancel it later. So premiums, at least on the exchange, went up really quickly, and insurance companies pulled out, particularly in rural areas.
If you don't enroll enough young and healthy, and you get primarily people who are sick or anticipate they will be sick, then that's not helpful. It's not just about how many people, but what type of mix of people you get in your pool. And that's what raises the rates for everybody.
The insurance company wants to lower the minimum coverage that plans are required to provide, which John says will make them cheaper. And insurance companies and brokers who sell plans also want to change something called the medical loss ratio. What is that, you may be asking yourself? It's the part of the Affordable Care Act that dictates how much money insurance companies have to spend on patient care. And that caps their profits. If the rules are changed, companies and brokers could stand to make more money. But too much of a shakeup in how the law is currently working, and insurers are going to have a tough time planning for the next few years, says Kim Menard of St. Louis University.
Insurance companies have to start making decisions about whether or not they're going to participate in the exchanges next year. You'll start to see a little bit of chaos unless they have more specificity about what the replacement plan would be.
Fewer choices on the marketplaces mean that patients might pay more or go without insurance entirely. And if fewer people have health insurance, doctors say they're worried it could reverse what they see as some pretty positive trends. Just ask Lannis Hall, a cancer doctor for Siteman Cancer Center in St. Peters, Missouri. She tells me she noticed something changed after the Affordable Care Act.
Prior to the Affordable Care Act, many of them would call during the year and let our staff know that they weren't coming for an appointment because they had lost their insurance.
In the past, her patients would go through cancer treatment and hit their plan's lifetime limit, a ceiling on how much care a plan would pay for. The Affordable Care Act got rid of lifetime limits, and it forbid insurers from denying coverage or charging extra if someone has a pre-existing condition. And this isn't just people who are sick. Lannis says she's seen an uptick in willingness to get cancer screenings too.
And in the past, many of them would say, well, my copay was too high, or I haven't met my deductible and I don't want to get it done.
There's some research suggesting this observation isn't just anecdotal, at least among Medicare patients. Not only can diagnosing cancer early be the difference between life or death, it can also significantly lower medical costs over the course of treatment. Now, whether or not the ACA is actually reducing healthcare spending the way it was supposed to is debatable. The rate of increase is lower today than it was in the 90s and early 2000s, but national health spending is still rising faster than inflation. Spending in this case means more than what people pay in insurance premiums. When you get your hip replaced and your insurance plan pays the doctor, that's health spending. When you pick up your prescription at the pharmacy and pay out of pocket, that's health spending too.
That's the reality of the deal here, is that healthcare costs money, and we're moving the deck chairs on the Titanic.
That's Tim McBride, a public health professor at Washington University who studies the economics of the healthcare industry. He says some of the decrease is due to the recession and a sluggish recovery. But if Congress repeals the Affordable Care Act and millions of Americans lose their insurance, it could make healthcare spending increase at an even faster clip.
They don't just go away and not use healthcare. They're probably going to continue to use healthcare. They'll go to the hospitals, they'll go to free clinics, they'll end up in the doctor's offices to the tune of about $1.5 billion.
For hospitals, this effect is multiplied for every uninsured patient they see. And Tim says 9% of U.S. jobs are in healthcare. It's the main industry that stayed steady throughout the recession. Put more uncertainty into the mix, and there could be a lot of effects we're not expecting to see.
The Affordable Care Act gave a lot more people, millions more people, access to health insurance. But not everyone in the country uses it. In fact, there's a big group of people who've opted out voluntarily altogether, but they still face a lot of the same issues. So after the break, we take you inside what you could call an alternate healthcare universe. All right, so in the first half of the show, we heard health reporter Duri Buskarin walk us through the ripples of anxiety over the future of the 6-year-old Affordable Care Act, which Republicans have vowed to dismantle and replace.
And a lot of the worry, from patients to insurance companies, centers on money. And the cost of healthcare is at the heart of our next story. But there's a twist.
Because imagine a world in which you need healthcare and you got to keep costs down, but you don't believe in health insurance, like at all.
For thousands of people in the U.S., this scenario isn't make-believe. It's a reality. And here in Missouri, there's one group of patients that's helping develop a new model for upfront pricing at a small rural hospital.
That cutting-edge group of people, the Amish and Mennonites, they don't have any issues with modern medicine, but they shun health insurance because they believe members of the church have a religious duty to care for one another, and that means banding together to pay healthcare bills rather than having individual health insurance plans.
This belief led to an experiment of sorts in rural Missouri. Bram Sable-Smith, a health reporter at KBIA, the public radio station in Columbia, Missouri, has been covering this experiment for more than a year. And his reporting gives us insight into other ways the healthcare industry is changing.
This story starts up in Unionville, Missouri. It's a small rural town in the northern part of the state, about 10 miles from the Iowa border. I drove up here to meet an Amish man named Truman.
Yeah, you want to go up to the office, or where do you want to? Yeah, that'd be great.
Now, when I say Amish here, what I really mean is that Truman is a conservative Amish Mennonite. It's one of several branches of the Anabaptist movement. But Truman didn't invite me into the office of his large pole barn to talk about the 300-year history of the Pennsylvania Dutch in this country. I was there to talk about his medical bills.
Healthcare cost has been major in my family. It's caused us some stress. I mean, in 2 years' time, with my wife and I, and my son had an accident, we faced approximately $80,000 worth of medical bills.
And his family income depends on him being healthy enough to do manual labor. He grows corn and soybeans, raises hogs. He's got a business building sheds. But Truman has also had a whole string of health scares starting back in 2008.
We were suspicious of maybe some colon cancer. We were passing blood, and the doctors here I need to take care of that.
Taking care of that meant getting a colonoscopy. So Truman started looking for a place to get that procedure done.
Checking around prices locally was so extremely high that we ended up going to Mexico to do that, to get those checked out.
Truman went all the way from his home in rural Missouri to Tijuana, Mexico to get a colonoscopy.
We flew into San Diego, and then they picked us up. Tijuana's just across the border. And so the doctor's office there in Tijuana, they had a van up there to pick us up at the airport in San Diego.
Now, at this point, you might be thinking, what's an Amish man doing flying around looking for the best deals on a medical procedure? After all, Amish often conjure up images of a horse and buggy. Well, the Amish and Mennonites are branches of a sect known as the Anabaptists, and different churches have different rules. It just so happens that Truman's church allows for flying and for cars, although other churches don't.
There's actually Mennonites that do also drive horse and buggy. We call them horse and buggy Mennonites.
Truman's church also allows for phones and fax machines, but they do stay away from the internet and from TV and from radios.
There's quite a variety of flavor of Amish and Mennonites.
But most Amish and Mennonite churches agree on one thing. They shun health insurance. Many are even exempt from Obamacare. Instead, they pay cash for their medical care, which is why Truman went to Mexico.
Simply the cost is prohibitive up here. You could fly down there and come back and have a fraction of the price.
So how much did Truman save by going to Mexico for the colonoscopy? Well, he couldn't remember exactly, but he thinks the whole trip, the plane, the procedure, it only cost him about $800. A colonoscopy in the U.S. can cost thousands of dollars. But that's actually kind of small compared to last year, when Truman developed gallstones and needed to get his gallbladder removed. He found out he could save $3,000 to $4,000 by getting the procedure done in Ohio instead of nearby Kirksville. But
I wasn't able to take the pain, and it was bothering me so bad I had to get it out, and so it landed in Kirksville.
And after the surgery, he started getting bills. Not just one bill for a gallbladder removal. There was a bill from the hospital. There was one from the anesthesiologist, one from the radiologist.
And they don't seem to stop coming for a long time. And it usually ends up being a tremendous price, and it was.
After some haggling, the price came out to about $8,000. But that was still way more than he was planning to pay out in Ohio. And he started thinking, there's got to be a better solution.
Why am I going to Mexico? Why am I running to Ohio? Why can't we do this right here and keep the business local?
Truman didn't realize it at the time, but he had that thought at exactly the right moment. Truman lives in Putnam County, Missouri, and the county hospital there was getting pretty desperate for new customers. Actually, small rural hospitals all over the country are desperate for new customers. 80 have closed since 2010 alone, and that number's only going up. Back in 2012, it looked like the Putnam County Memorial Hospital was going to be one of them. Why are rural hospitals having so much trouble? Well, as the younger, healthier people move away for jobs in the city, you're left with older, sicker folks.
90% of our business was Medicare, Medicaid. That's a very dangerous situation.
That's Jerry Cummings. He and his wife Cindy were hired in 2012 to save the Putnam County Hospital. One of the biggest problems they faced was that Medicare and Medicaid patients don't really bring in enough to cover overhead. So for years, the hospital had been cutting services. Surgery? Gone. Physical therapy? Gone. Those things just cost too much. But without them, the hospital kept losing patients, which meant they were losing money. So Jerry and Cindy Cummings reversed course.
Surgery had been closed at this hospital for 10 years. So when we first talked about opening the surgery department up again, eyes kind of rolled like, oh no, we can't do that. We can't. Never did anything.
While everyone else in the country was cutting services, they started bringing them back. They reopened surgery, they brought in cardiology, and the patients, they started coming back too.
You would hear our staff walk by and they'd see them in their surgical scrubs and in their gowns, and they'd say, it feels like a real hospital again.
And the approach started to work. They brought the hospital back from the brink of closure. But that was only the beginning. Keeping the hospital open would mean diversifying their patient base.
We got to have other programs other than Medicare in order to survive.
And that would require a lot more work. So imagine Jerry's reaction when he got this call from a surgeon in the area.
He says, I have a patient that's an Amish patient or a Mennonite patient, and they're getting ready to go to Ohio. They got a quote in, I think it was Dayton, Ohio, and it was going to cost $1,200. Is there any way you could give me a price for you to do it over there?
Turns out there was. The Cummings started making deals with a few Amish and Mennonite patients, including Truman, to bring them into their hospital.
Just this year, I had to do another follow-up colonoscopy here and I did here in Unionville, and it was competitive enough. It wasn't worth my time to go to Ohio.
Very quickly, the Cummings realized, for two big reasons, a relationship with the Amish and Mennonites could be a game changer. Reason number one, while most rural America has seen decades of disappearing jobs and residents, the Amish population is actually booming in those same areas. There are more than 50 new Amish settlements in Missouri today than there were 20 years ago. By one estimate, there are almost 20,000 Amish and Mennonites in Missouri alone, a number that's growing. And that doesn't include all the Amish and Mennonites in Iowa, Illinois, Nebraska, and Kansas. Those states aren't far from Putnam County either. Having a hospital here that caters to their community's needs would be much more convenient than traveling out to Ohio, and definitely more convenient than going down to Mexico. In other words, serving the Amish would open up a big untapped customer base for the hospital. Reason number two is something called Freundschaft. It's a word in Pennsylvania Dutch that basically means kinship. As a concept, Freundschaft represents the value the Amish and Mennonites put on community, on actually caring for one another. Like, if something happens to someone and they end up with huge medical bills they can't cover, their community will step in and help them out. Here's how one church leader explained it.
Our ultimate kitty is the church. We have deacons that take care of that, and we don't have any members in good standing that don't pay their bills and that bills ain't paid. I think all of us here are totally agreed with that.
Because of Freundschaft, a hospital can be reasonably certain that the bills for an Anabaptist patient will get paid. And the Putnam County Hospital needs that and the potentially thousands of Amish and Mennonite patients that would be paying cash up front. But a deal like that doesn't just happen overnight. And that's why, at the end of 2015, the Cummings assembled a committee of 6 Amish and Mennonite men, elders from different church districts in the area, to negotiate a plan. They came to the hospital one night in October for a meeting with the Cummings and 3 more people from the hospital leadership. First, everyone sat down in the cafeteria for taco salad dinner before filing into a small conference room to get down to business. They let me record the meeting, although the Amish and Mennonites asked that I not use their names.
We're pretty low-profile people when it comes to the media.
Okay.
And so
During the meeting, Jerry Cummings tried to make a point about drug pricing that, for obvious reasons, didn't really land.
You saw it on TV last week where this drug company bought this one drug.
We didn't see it.
Let me explain that.
So Jerry forgot that his guests don't watch TV. But what he's doing here is actually really cool. He's basically asking this committee, how much do you want to pay? This kind of discussion, it's normally kept between insurance companies and hospitals. Consumers don't ever really participate or see that process. But here, with the Amish and Mennonites, it's right out there in the open. At one point, Jerry asked the representatives if they were interested in a percentage discount, like a flat 50% off of all their bills. One of the Amishmen spoke up and said that didn't really work for him. It was too unpredictable. And there was something else I wouldn't have expected at a negotiation. One of the Amishmen made a point to the group, and he concluded it by looking right at the Cummings and saying,
We're only looking at it from this side. I'm not looking at it from that side.
Right.
And so this has to make sense to you as well.
This is what really makes this negotiation unusual. It's not just the hospital trying to get as much as possible and an insurance company trying to pay the smallest amount it can. It's two sides working together. And the way each side is going to get what it wants is through something called price transparency.
This is where healthcare is moving, is to back to this one fee. You come in and you know what the price is because people want to know what it's going to cost them. So
People do want to know what a medical procedure is going to cost them, but that's not always easy or worth it to figure out. But here, it could be what saves this hospital.
You're a very vital part of our future because you're paying cash, whether it's cash up front or we send it on a payment plan.
And the Amish and Mennonite communities get what they want too. Lower healthcare prices close to home. Everybody wins. People who study rural healthcare say this could be more common for rural hospitals all over. And who knows, the trend may spread to the rest of the country as well.
So, Bram, you reported this story originally about a year ago. So catch us up. What's going on now?
So not much is going on at the moment. Right at the end of my reporting on this story, at the end of 2015, before we were about to hit publish on it, the Cummings resigned from the hospital board. There were reports of really crippling debt on the hospital, and a lot of the people I was speaking to up there, up in Putnam County, kind of went tight-lipped. They weren't really talking about it anymore. And after the Cummings resigned, there was about a year of layoffs and resignations. Those are the reports coming out in Putnam County until just this past September. The hospital was leased out to a Florida company that specializes in really turning around small rural hospitals with financial problems, just like this one.
All right, so big changes at the hospital, changes in management, changes in ownership. What does this mean for this whole collective negotiation that's happening with the Amish? Is that still happening? And if not, then what now?
Yeah, so I called up Truman to ask him, and he said, the hospital expressed interest in keeping the program going for a while. They even scheduled a few meetings, but those eventually got canceled, and the program's kind of fallen by the wayside. And for Truman himself, it means deferred medical care. It means he's not getting the care he wants. He told me he needs to get a stress test to check out his heart, and he called the hospital to see if they had the program going, and they didn't. So he's going to have to go out to Ohio, but that's a hassle. He's a farmer. Harvesting season just happened, so he's been putting off getting this medical procedure done until he can get out to Ohio.
At the end of your story, you said that this idea of the bargaining could spread. Has it?
Yes and no. Here's the no first. The negotiating directly with the customers and really a hospital negotiating directly with its community, that part was really unique to Putnam County, and that's not really catching on around the country. But the logic behind it, price transparency, it's what Cindy Cummings spoke to in the story. And that really is where the healthcare industry is moving. We're seeing more hospital systems having some kind of price transparency, making prices available up front. We're seeing more state legislatures developing price transparency tools. We're seeing it in hospitals in California, New Hampshire, Maine, Colorado, Philadelphia, Pittsburgh. I mean, it's really happening around the country, and it is going to be a larger part of the healthcare industry moving forward.
Like we told you at the top of the show, This is our last episode of Season 2, and we're planning to be back with Season 3 in late spring. That's our best guess. But we'll be passing along updates along the way, so you'll still be hearing from us. So still check us once in a while in your iTunes feed. We also have some things in the works that we're hoping will take our show to the next level.
And we should say some things could change. We don't know for sure yet.
They could. We may be asking you guys for what you might like.
Mm-hmm.
But in putting together this episode, it reminded us of why our focus is on how systems touch people.
Because this massive 2,700 or whatever pages bill, whether you like it or you hate it or you don't care about it, boils down to a remarkably simple thing. People just want to be healthy. Healthy to go to work.
Healthy to hang out with friends.
Healthy to raise their kids.
And measuring how well any system is working doesn't only come down to analyzing policy on a page. It comes down to how well it treats the people living inside of it.
And those are the stories we plan to keep telling. We Live Here is produced by me, Tim Lloyd.
And me, Camille Stanley.
Shula Newman is the executive editor of St. Louis Public Radio.
And Cassie Morgan composed our theme music.
And from St. Louis Public Radio, we'll see you guys in a few months.
Yeah. This is We Live Here.
Bye.
Support for this podcast comes from the Corporation for Public Broadcasting.